gather up your supplies. You have to wash your hands, okay? You have to identify the patient and tell them what you're doing. Now, with this particular skill, you did the suctioning, and then usually after you suction, at the end of that skill, you would wash your hands, take off your PPE, and then leave the room and document. Leave the patient in the lowest possible position. When we say give them the call bell, give them the call bell. Most of the beds here all have call bells, so make sure you do it. Just don't say it, and then go document. But for this practicum, you're going to suction and go right into care, so you don't have to leave the room. But I would say to the professor, at this point, I'm going to remain at the bedside. I wouldn't remove my, if I was just doing this skill, I'd go document and get rid of my PPE. But at this point, I'm just going to stay here and continue on with the care, okay? So I got rid of my gloves, and I would say I'd go wash my hands, make sure the side rail is up. I would wash my hands, okay? I just, you know, you just suctioned, and you had gloves on, and is there a chance that maybe you touched something? Sure, there's organisms now on you, right? So, okay, you put the gown, glove, mask on, whatever you need. You identify the patient. You close the curtains. You guys need all that. Now redo your assessment. You just suctioned. You even just assessed at the end of the suctioning, but you're starting a new skill. Re-identify the patient. Redo the assessment piece, okay? And you're determining the need for the care. Again, I like that head like that, okay? Tell the patient what you're doing, okay? Explain to the patient, and I really do like this piece of it because I think we forget this because these are mannequins. Tell the patient if you have any trouble, okay, or difficulty breathing, or you don't feel right. Let me know, give me the thumb, or give me something like this. It's like when you're in the dentist chair, you know? It's like when you're in the dentist chair and you know, like this and you don't feel right. You know, tell the patient if you don't feel right, definitely let me know and I will stop and help you, okay? That's huge. You want the bed. Remember when we started this skill, I said raise the bed, because this is not a skill that you want to be over like this. You know, you really want to be in a position that's convenient. Rita, did you have a question about a syringe? I see you have a syringe in your hand.
No, I just picked it up off.
Because I don't see any sub-Qs except the TBs, and I was telling the students to use those for sub-Qs. The needle size is too long, but that's what I've been telling them to practice with.
Okay.
And for the IMs, they're the white, they have white wrappers on them for 1.5s. I don't have them use the other ones because we have extra ones with the white wrappers. Thanks. Okay, so getting back to the trach. Now, this is where this is a change. It's not a bad change. And it's step number 8. Professor Gill wants you to open up all your supplies. So keep them in the wrappers, okay? If you don't have a wrapper on the practicum, you know, for anything, when you bring your supplies in and you wash your hands, have some kind of paper towel or something so you can put it on. You know, this is for practicum's sake, okay? So you need a new inner cannula, right? I'm going to go with this slowly and line this up for you. Hi there, how are you? Good. So you have the inner cannula. So open up the package. You're going to need Q-tips, all right? I would probably bring in at least 2. You need 2 or 4, all right? Because you need 1 there and 1 there. Maybe just 2 you need. This is to clean the stoma. The Q-tips are cleaning the stoma. So I just want to line it up first, okay? So you need this. You probably need the water. Yep. Oh, sterile cup. Okay. I would open. Okay, so I'm not going to need this. Okay, let's see. This should be in there. Okay. Don't need. See, notice I'm not turning my back, am I? Not turning my back. Okay. Open up the saline. Here we go with the saline thing again. But right now I just loosened it. These are all in packages. These are all in packages. Loosen that. Now, in number 8, she's telling you, open up a sterile cup and open up the Velcro ties within reach of your work table. Notice how I have them in some kind of order. This is a change, not only for you, it's a change for me. All right? How am I doing? Good? Okay. Put on disposable gloves. Here we go with the gloves. I'm on step 9 if you're keeping track. All right. Okay. I have to lip it, check for 24 hours, and I have to put it in there. Can't wet anything else in there, gang. Okay? I don't need this anymore. I put the cap on and I put it behind me. Notice I did not turn my back on my field. You leaving?
Yeah.
Good. Have a great day. Okay. So this kind of is the order. This is in a package. This is in a package open. This is in a package open. So when you open up these packages, it's not like you're ripping them apart like a dog having a snack, like my golden takes the snack, out of my hand. So they have to be opened like when you were in nursing 1 and you did all those wounds. Remember the packages just so? Don't fill this up too much. See what I just did? Okay. Let's see. Okay. Okay, remove the oxygen. This is the skill where it goes on, off, on, off, on, off. And you can see that with step 10 till about 13, 12, it goes off, on, right? If you read that. So I take this off. Okay. I remove the fenestrated dressing from the patient. I'm always having my hand on the face plate. I don't care if the inner cannula comes out. I could care less. I don't want that trach to come out, all right? So I'm kind of securing. See, I have my one finger here. I'm exaggerating that. And I'm kind of pulling this out, kind of turning it inside out and throwing it away. Okay, and I know that's secure there. All right, see, and she even says that's secure, all right? You're going to grab whatever the device is here. It could be pinching, it could be turning, but whatever it is, you're going to, removing the inner cannula now. Okay, so I got my finger here on the faceplate so it doesn't come out to secure it. I pinch, and they don't go exactly just straight in. They kind of go in and they turn. I take it out, and this would get thrown away. For lab purposes, we save these, okay? So I gently take this out. Now, if you turn your page, okay, now she wants me to replace the oxygen, because don't forget, okay? Like I said, this is, when in doubt, replace or remove. For this, when in doubt, replace or remove. Don't forget, it's just not about the practicum. Think of the reality. You're now getting ready. It's going to take you a little bit. It's going to take me a little bit. Patient, you're it. This patient can't get that oxygen in there. All right? So when in doubt, put it on or take it off. You're never wrong. All right? So we're on end of number 10. Now I take my gloves off. And now I'm going to put on my sterile gloves. Whether the gloves are in a kit or you would always bring in an extra pair with you. All right? And I put them on the cart for you. Put on your sterile gloves. Go ahead. Talk to me. Talk to me. Okay. Thank you. Well, if it fell on the bed, it fell on the bed, wouldn't it? But don't forget, you have that open. See, this is where the change took place. We used to use the stuff in the kit. And I think what's going to happen now, eventually we won't have the kit, because to be honest with you, most of the kit pieces are thrown away. So even in the hospital, you're using what you have in there. All right? These particular gloves, which are lovely, they tell me right and left. Isn't that nice? I think that's nice. Oh, my gloves. Now, you could use these. You can use these, or use the ones that are prepped there. if the paper starts dancing on you, remember in nursing 1, secure it here with this hand. My hand is bare now, right? Just secure it. I'm less than an inch away. When you pick up that sterile glove, you notice my thumb is out, my other 4 fingers are under the cuff, okay? You cannot touch once this hand, see my bare hand, goes in that glove, watch this thumb. You cannot do this. Can't do this. I just contaminated it, didn't I? Okay. Ooh, you guys remembered, you did very good. I'm so proud of you. Okay. Got my gloves on. Let's see, I'm on step number 12 here. We're 12. Where are we here?
We're on 11.
We 11? No, we did 11.
No, we're putting the new inner cannula. Picking up the new inner cannula.
We're on 11.
Yep.
Right? So I put on my sterile gloves. Now I remove the oxygen source again with the non-dominant hand. This is my non-dominant hand. I pick up the oxygen source. Notice I'm not going over things. I kind of pulled this out. That's why I have you line things up. See how nice and lined up they would be? Line things up, and I put it in. And when you put these in, you can't have your glove. No, you can't have your glove over this, okay? You kind of have to have it free, because that's how they're getting their air.
Okay, so the non-dominant hand now is going to be your
You know what?
clean hand.
I don't want to say sterile, dirty. I don't want to get into that because, especially the word dirty, you don't ever want to say, practice even saying that because you don't want to say the word dirty in front of a patient.
Right.
Just say the non-dominant hand. Don't even worry about if it's sterile or not sterile.
Okay.
At this point, virtually, there is no more sterility. The piece of the priority here is that this inner cannula that went in stays sterile.
Okay.
Okay, and let me just say, that's why I'm showing you how this goes in.
Okay.
This has to stay sterile. So when you're pinching this, you don't want to be touching this with your fingers. Okay, if you need to grab it out of the package, you know, let's say it's in a package, grab it, you know, grab it, not this hand, grab it, but you don't want to be touching this, okay? Grab it, kind of go to the side. See how I'm horizontal, I'll call it, and then I halfway and I turn. And I put my non-dominant, when I'm locking this in, hold the faceplate and lock it in.
Okay.
That's really the sterile piece of this whole procedure, understandable. So we're on step number 11 and we just reapply the oxygen. It says if needed, do it. Okay, it's off. Now I put it on my non-dominant hand. Okay, now we're gonna clean, all right? So while let's say this is open. Well, hello there, how are you? Let's say this is opened, and these would be here in the package, okay? These are all in a package, all right? I remove the oxygen source. Sorry about that, baby. Okay, I take my Q-tip, I dip it in my water. We're on step 12, okay? I'm cleaning the stoma. So with my non-dominant hand, I pick up the faceplate, and I go I'm working on the side away from me first. Remember when we did bed baths? Remember when we assess things? You always start with the opposite side first and then on the side closer to you. Okay? So I flip up the faceplate and I go top to bottom in a quarter moon shape. Remember when we were doing moons, top to bottom? Okay? Top to bottom, and I throw it away. I get the second one, and I lift up the faceplate. I'm using the side closer to me. I do top to bottom, and I throw it away. Okay, so I just cleaned the stoma, cleaned from the bottom up. So the stoma and then the faceplate. Okay, we